actually starts a little bit higher because I include the glutes in that. But for the anterior portion or the front portion, we're going to be looking at basically where this little indentation happens, okay? And so on the lateral side, right, we're going to find two major curves. There's 1 and 2. So when you're thinking about the basic structure, right, we're not even thinking about muscles yet. Okay, and then on the medial side, we have 1, 2, and 3 at a straight, right? So just think 2 on the lateral, 3 on the medial. Okay, if you ever have to invent a leg and you're still uncertain after this course, because it does take a few years to get this stuff ingrained in your brain, and you can't draw like an invent anatomy from memory, this is the very least you can remember, is that there's 2 major curves on the lateral, 3 on the medial. Also consider, once again, the asymmetry, right? So I might use this terminology as well. This is called the apex of a curve, right? So basically where it curves the most, and most of the time it's in the center, sometimes it's not, right? So if I look at, let me grab another color here. If I look at where this curves the most versus here, we can see this asymmetry across the form, right? And then same thing here. So it's never going to be straight across from one another. Like if I were drawing a leg and I said, okay, I have 2 curves here, and then I have 3 curves here, right? That looks so wrong, right? So just take note on the fact that all curves need to be asymmetric from one another. Right, get rid of this stuff. Okay, so this is about, by the way, this whole thing is approximately 6 cranial units. Okay, so remember back to our first lesson, right? A cranial unit on the little skeleton up here, right? So it's 6 of those spaces. And the patella, fancy word for our knee in here, okay, lies about halfway. Okay, and if I subdivide that again, I get where this little depression is. That's about in between the upper leg space, halfway. And if I look at this little depression in the lower leg, that is halfway as well. So everything really subdivides very easily. We have whole round numbers. We're not thinking about like, oh, this is approximately 2.5 or 2 7/8 or something. It's all very simple math, so that's a good thing. All right, so we have the red here. Let me grab red. And this is our sartorius muscle. Okay, originates up at the ASIS point, if you guys remember that from our first lesson. Once again, all this stuff is so important to memorize, right? And notice how it looks like that ribbon, right? It's a really nice rhythm that a lot of artists use, okay? It also helps us find where the adductors are, which we'll talk about in a minute. Okay, our inner thigh stuff, right? It's going to attach at this little bump here. Does anyone remember what that's called? Starts with a T. Tibial tuberosity. All right, so this is also one of our landmarks that we talked about, okay, in our first lesson there. And so it's important to note that it basically goes to the side of the leg. So it's not hanging out in front there. Notice how, remember when I turned the ribbon sideways, you only saw a little line? That's what that is there. It's literally going to the side of our quad muscles, which are all those things there. All right, so speaking of our inner thighs, we're just going to call these the adductor group. Adductor group can be seen from the back, from the inside, and from the front. So they wrap around around the entire medial portion of the leg, right? It kind of looks like a little triangle, which is nice, right? And just so you know, our sartorius muscle is in front of the adductors, so they overlap the adductors. Sometimes on super lean people, you might see like, little striations like this. Okay, but I wouldn't worry about it because most of us, even people who have like 5%, 6% body fat, tend to have like a fat pad that fits on top of that. So it smoothens out that sort of step down and it looks more like a cylinder. Okay, let me get rid of some of this. All right, so over here, this little itty bitty yellow thing, okay, that's called our TFL. You don't have to know the full name, just know that's an acronym or an abbreviation, okay? Notice it also, with the sartorius, right, there's our sartorius, it also connects to our ACES point, right? Think hip bone, ACES, okay? And oftentimes when this is flexed, it looks like a floating muscle or like a weird rounded bone that goes nowhere. And it's really confusing to a lot of people who don't know about this muscle. The reason why it looks like that is because this long white thing here is a tendon that it attaches to. And this is called the IT band. Once again, that's an acronym. You don't need to know. Just know it's IT band. All right? And it's basically the antagonist of this long muscle over here, which we're not going to talk about, and to some extent our sartorius muscle. Notice how they're both long and thin, ribbon-like, except this IT band is a tendon. Okay? So does anyone remember what I said about how tendons look? They can look like a flat space or a depression. Okay, it's not going to look like a bubbly muscle, right? It's going to look like either something like that, or it's going to look like an actual kind of V shape going inward. Okay. And this attaches, guess what? Attaches on the other side of that tibial tuberosity. More on the side than the sartorius muscles. Okay. All right, so same continued. We have our first dive over here on the left. And that arrow basically means that the orange muscle is diving in between the tunnel that the sartorius and the IT band are making, okay? And this muscle is part of our quadriceps or quads. Let's just call them quads, okay? And this one here is the first of the four, and it's called our rectus femoris or femoris, however you want to pronounce it. Doesn't matter to me, okay? Notice how it ends, and I haven't described anything yet there on the left. Okay. This is the part on cartoon characters that typically gets really over emphasized, especially on the men. Right? We have this one. This is also part of our quads. This one is called our vastus medialis. So remember, medial means inside, medialis, right? That makes sense, logically speaking. And oftentimes you'll see it, oh, now it lets me zoom in. Thanks a lot. Yeah, okay. So this part in here, oftentimes if you stand up straight without bending your knees and you flex your quads, you will see a little indentation there. That's because the muscle belly sits really low on top of the patella. The patella would be right in here, right? And so it looks like it's doing kind of this reverse C curve looking thing. All right, and then lastly, we have our vastus
It's here. Just এখানে.
lateralis.
It's the thing that covers your knee.
Because lateral, get it? Lateralis. Okay.
Lateral মনে আছে?
This one sits a bit higher
Outside.
than the medialis, right? Note where the blue ends and the purple begins, right? And all of these things, by the way, I think all of my examples have white for tendon zones. All three of these muscles culminate into one singular tendon. The rectus femoris tendon sticks out a little bit or overlaps the other two, but they're all connected together above the knee, right? So because that tendon is there above the knee, if you had really big quads, you're going to see a depression right above your knee, right?
The yellow muscle.
Tendon zone.
That's the quad.
All right.
The yellow muscle?
Yeah.
So now we have the lower leg from the front and the inside. I just kind of left this one here because why not? It'll help